Next up, we've got Andy Bell from the United Kingdom Centre for Mental Health and also Equally Well in the UK. Andy's been with the Centre for Mental Health UK since 2002 and previously working for the King's Fund. He began as Director of Communications and becoming Deputy Chief Executive in 2009. Welcome, Andy.
Okay, you ready for me to start? I can give it a go, and hopefully so my name's Lee. That we've experienced working here in the UK with our own Equally Well collaborative, and my is take you through. So, Lee, if it's possible to do the next slide, that would be brilliant, and hopefully that will tell you a little bit about us. Our main role as Centre for Mental Health is all about tackling inequalities in mental health. We do that across a number of dimensions. We're mainly a research organisation, but our work is also about advocacy in terms of mental health policy. It's about co-producing with people with lived experience of many different types of mental health challenge to ensure that the evidence we bring to bear is based on real life experience. And it's also about trying to change the way systems work across the country to ensure that people living with mental health difficulties or indeed at risk of mental health difficulties have the best chance in life and best opportunities for good support. Equally Well is one of our projects. We're very proud to be the UK host of Equally Well, and we work alongside an amazing organisation called Rethink Mental Illness in order to do that. So my job is just to tell you a little bit about how we do it. There'll be lots of similarities to you, I know, because we work very closely with Lee and Russell and other members of the team, as well as our brilliant colleagues in New Zealand. So some of it will be very familiar, some may be different, but I hope it's useful. Next slide, please. And hopefully you can see something that says unequal health outcomes. This will not be new news to you, but I thought I'd share it, partly because it's important to understand what motivated us to take on an Equally Well collaborative here, but also because there is some data that comes particularly from our primary care services, which I think is really powerful. So we know that people living with a mental illness have a life expectancy that is significantly shorter and higher levels of what's called premature mortality, which here means dying before the age of 75. But what we also know is that is reflected in a whole range of other health outcomes. And what we see is that harm to physical health happens very early. So people in their 20s and 30s have the physical health of someone who's 50. The first one, inspired entirely by conversations with Helen Lockett from New Zealand, is a